Well, hello again, everybody. Today is Wednesday, September 23rd. Welcome back into the Keep Boone Healthy Facebook page. I'm David Jackson with the Boone Area Chamber of Commerce, joined by longtime friend of the program, Jennifer Green, the Director of Public Health for App Healthcare. So glad to have you back with us again. It is about that time where we do our periodic check-in with App Healthcare and just get a sense, Jen, of where the community sits right now with COVID-19 numbers, response, and all of the things that you and your staff are tracking and dealing with on a daily basis.
Well, thanks, David. We're glad to be back and happy to, it's amazing how the time has passed. We're already into fall. So thanks for having us back.
Well, I know it is amazing how it feels like we've been doing these things forever. And then you look back at the calendar and then you look and say, oh, that was March. It's not that long ago necessarily, but a lot of time has transpired since we first started these conversations, though. And you look back at where things are progressing now. What can you tell us about where Watauga County and the entire district that you are in charge of, sit right now in terms of the metrics that we have all gotten so used to tracking ourselves on a daily basis?
Well, I can say we are continuing to monitor things. You've probably been tracking the cases, just like we have. We did see an increase in cases over the last month, 6 weeks, and we expected that. So we've talked about the fact that we are ready for a rainstorm and we don't want it to turn into a flash flood of cases. So I'm cautiously optimistic. We're continuing to monitor things pretty carefully. We have had some additional situations recently where we've announced clusters. Of course, we've got an ongoing outbreak at Glenbridge that we are very saddened by and are doing our best to work carefully with them. So there are some things that concern me, but there's also some bright spots. We are seeing more evidence at the state level that, though we've seen an increase in cases, it's not a spike in cases necessarily. We've sort of had an increase in a leveled off at a higher number of cases consistently. So we're going to have to continue to be cautious and monitor things, but I'm not as concerned as I might have been at one point pre-August, but I'm not saying that we're all good. I think this is an opportunity for us to really dig into the prevention that we've all heard about so much, and show our love to our community by wearing our face covering and washing our hands, and also helping make sure that your community is informed, the people that you're around, related to potentially your exposure that you might have had.
I know a lot of people track the metrics in terms of cases and active cases, and that seems to grab all the headlines. But I know another part of certainly what we've heard out of Dr. Mandy Cohen with the state, and you have been singing this all along as well, is access to some of the other key elements that make the response work, such as PPE for frontline workers, access to testing, things along those lines. Can you give us a sense now, as we are, again, several months into this, as how those particular things have made their way to Watauga County? Do you feel like this area has enough access to testing, access to rapid testing, and certainly the PPE that can make sure that those frontline workers and others that utilize that on a daily basis will still have a good supply of that as we move a little bit further into fall?
Well, we've had some concerns in the past about access to PPE and test supplies, but I will just say things have improved, and we don't have the same concern about access to the personal protective equipment for healthcare workers. And there is an established process for facilities who are in the front lines doing healthcare services to request some assistance with that. There's also a pretty strong case to be made for improvements in test turnaround times. We saw some delays in testing turnaround that really concerned us, but things are really much better than they were. We're glad to see more rapid tests being available, but also the tests that we are running now, it's about 2 days versus 5 to 7, which is what we were seeing previously. So that situation has improved dramatically as well.
One of the things that I think people, can continue to get educated on is just that rapid test process. There have been some that have taken the rapid test and also get a regular test at the same time. Is that still part of the protocol, or is that moved around at all now that again, as you mentioned, testing turnaround times have dramatically improved here over the last month or so?
Yeah, so I think rapid tests are a great tool, and particularly if they're with your healthcare provider, they are best equipped to try to help you understand, what might be going on, if it's COVID-like symptoms or if it's something else that they might believe could be a diagnosis. The one difference in rapid tests, most of them out there are antigen tests, so they are not considered lab-confirmed cases. So in general, we still treat a positive antigen test as a positive case. That is how we address that in public health. We do contact tracing on those cases just like we would any other result. The one difference you might notice is that we are counting them in the local count because they are a probable case, and they count towards our numbers because we're treating them the same. And that's following CDC recommendations too. But it shows some discrepancy between our dashboard and what's on the state dashboard. I do believe there's a strong effort to put out more information on the state dashboard that we will likely see soon about antigen testing and how that will feed into our overall results. But in general, I think it's a good tool.
So speaking of state resources, recently announced the state got that the app that I know you alluded to several weeks ago, Slow COVID NC. Can you tell us a little bit about what this app can do in terms of helping you and your staff with contact tracing, but I think probably also answering some of the questions about privacy that have certainly risen to the top of the discussion here lately as people try to decide, hey, is this something that I want to put on my phone and get tracked? Just not knowing where that data goes. Can you explain any of that process as you've been involved with that?
Sure. So if you go to the App Store and you can find Slow COVID NC, it's a free app. I have downloaded it on my phone, and I don't know if I can find it fast enough here to show you, but it does walk you through how it works. So if you're just curious and you want to download it and walk through how does the app actually work, it actually walks you through how it is notifying other phones. So the intent behind it is that if you have this on your phone, and David, you had this on your phone and I have it on mine, and we are within 6 feet of each other for 15 minutes or longer, and I get sick and I've forgotten that I've been around you, I can call and I'll get a PIN number that will authenticate the fact that, yes, I have a positive test result. That gets entered into the app, and then that app will automatically notify the phones that have been around it using Bluetooth technology. And I'm not a tech expert here, so I'll just admit to that. But the way I understand it is it's using an automatic replication of a series of characters versus GPS location. So that made me feel better about putting it on my phone versus, that. And also it's anonymous. So it's not tied to me directly. It's just gonna, if that happened and we were around each other, it would notify you that, hey, you may have been around someone, you might have been exposed, and here's some other guidance, symptoms to watch for, or even linking you to where you might get tested. So it's meant to be another tool in the toolbox. It doesn't replace contact tracing in general, but it's helpful. And I think that when we have more tools available, that helps us protect our community. So I hope folks will download it and consider using it and at least take a look at it. If you do have to have your Bluetooth on if you're using it. So for me, I use my Bluetooth for my steps, and it allows me to stay connected that way. So it was pretty easy for me to decide, hey, I want to do this to protect the people I'm around.
So mine says no. I don't think you can see this, or maybe not. No exposures detected. So I'm good. I'm in a safe spot.
Good.
But yeah, I do agree. I think the understanding there that it is not a GPS tracking. So there are some people that were concerned that maybe others outside actors could gain access to data that would talk about where you are using the random number generator and the Bluetooth. It does keep it anonymous. So that is a good source of information to get out to people to make sure that you know that it is a safe technology and hopefully one that is useful should you need it. And again, another sign of the evolution of things that we are talking about now that we never thought we'd have to talk about
Right.
back 7-8 months ago. I guess, Jen, I want to kind of close with, we've talked a lot about the transition of season. Certainly, there are some business implications to that, and we expect to hear more news out of the governor's office next week about where the safer at home order moves from here, and whether that means expanded capacity for businesses that are maybe looking at the calendar and thinking outside options for seating and for putting merchandise are not going to necessarily be as comfortably available to us here in the next few weeks. But as you look at other challenges that we face with dealing with a pandemic heading into winter time, when we know cold and flu season really hits us hard, what are some other things that people may be able to do just to stay vigilant, not just necessarily in the confines of COVID-19, but for people with employees that are just trying to keep the workforce healthy at this point in time? What are some things that you might suggest as we move into colder times and colder months ahead?
I would say get your flu shot if you are someone who always holds out and you don't normally do it, or even if you do, hit or miss, get your flu shot. Of all years, this should be your year to get your flu shot, and your family to get vaccinated against the flu. It is going to be incredibly important. We know that flu is a different virus, but it also can be very serious. And then on top of that, I would say, we always tell people during flu season, stay home if you're sick. It's really important that you stay home if you're sick. And I say that just from our experience talking with folks through this COVID pandemic over the last 6 weeks or so. We become a little complacent when we've heard the same thing over and over again. So just remember, be vigilant. If you are sick, stay home, because you could expose someone else. And certainly, what's going to be very helpful is providers are already preparing for what does it look like in a flu plus COVID world? How do we make sure that we keep everyone safe? And I think we have such good healthcare providers in our community here. They're going to be ready to help you if you are feeling ill, but do the right thing and stay home. Don't expose your coworkers to your illness, whatever it might be.
I know Dr. Elliott has framed that in the context of the Watauga County Schools conversation about the return to in-person learning and really trying to lean on the fact that it's not going to be the same old normal operation in terms of kids got some sniffles, let's just send them anyway. Really kind of reframing what that looks like, family to family, person to person, about what is the responsible behavior with going back to work, back to school, what have you. I'm sure that is somewhat of a moving target for everybody as they get re-immersed in some of those activities. But I'm sure that's exactly what you're alluding to is changing the norm from what we used to maybe do in terms of powering through those situations.
Yeah, and I will say I've been one of them. In the past.
I think we all have.
you just go, but now is not the time to do that. It's time to pause and really be self-aware.
So I lied. One last thing for you.
Yeah.
We'll keep going, right? We just mentioned a few moments ago a conversation coming out of the governor's office, state metrics continuing to improve. It seems like they're moving in a direction where there could be another positive step as we move. Is there any kind of inkling or anything you've seen in the trends that makes you think that yes, we are indeed in a position because of vigilance and because things are improving that we're able to make that next move, hopefully here soon?
Well, I think the statewide metrics are good to look at. And so if folks are interested, go to the dashboard at the state and actually look at the yellow line that shows, what's our rolling average. And I think we've actually, seen things not get as bad as we thought. We had a little bump in August. I think some of that, we could all draw conclusions about why that is. But I am hopeful that we will see more restrictions eased, and we'll continue to move forward in this different, COVID affected world, because that's what we all want, and I think that one of the keys in that is that we don't become complacent. We've got to continue to wear the mask, and make sure that you are distanced and wash your hands. I mean, all three of them are very important, and it takes all three of them done consistently to help us stay healthy. So let's all do our part so we can keep moving forward. That's what I want.
Well, we certainly appreciate your time here this evening and sharing this information with us. It's always so valuable to us. Thanks to you and your full staff for everything that you're doing on a daily basis and an hourly basis to make sure we've got great information and keeping us all healthy at the same time. So best to you. And I know you'll be on here again sooner than we can imagine.
Thanks, David.